2025, Uganda identified PAMIs for cholera elimination using the GTFCC methods and with the support of the WHO Nairobi Regional Hub.
Uganda has this week been in a process to prioritize areas for multi-sectoral intervention. This is quite key as the country aims to eliminate cholera by 2030.
PAMIs for elimination is for countries with no to low cholera transmission. As a guiding principle, those are countries where less than 5% of the geographic units reported cholera outbreaks in the past 5 years.
We have undertaken the process of PAMI identification, and in this process we have reviewed data for the cholera outbreaks that we have had over the last 5 years, and through that process we have been able to discover that we have done quite well over the last 5 years, and we're therefore eligible for cholera elimination.
Countries with no to low cholera transmission in recent years remain vulnerable to the reemergence of cholera outbreaks. Therefore, the identification of PAMIs is essential to mitigate vulnerabilities in order to achieve sustainable elimination.
The disasters, if I may say, it's one of the hazards that we've had in Uganda, had a number of places, especially following hazards such as floods. So we have the relationship between climate change, cholera, and disaster.
For the identification of PAMIs to be data-driven and objective, Uganda compiled data on recent cholera outbreaks as well as on cholera vulnerability factors.
One of the gaps was in as far as data is concerned. And I think this is where the PAMI has come in. PAMI gives us the data. One of the areas that pique our interest area on the vulnerability factors, the intensity, and also, of course, the possible frequency or occurrence of this cholera disease.
Once data were ready to guide data-driven decision-making on PAMIs, a multi-sectoral PAMI validation workshop took place to identify PAMIs in a participatory manner.
This process has been multi-sectoral, where we have brought together all actors involved in cholera. We have brought together the local governments, the partners, line ministries which are involved, like Ministry of Water and Environment, Ministry of Local Government, and stakeholders such as UNICEF, Africa CDC, WHO, and local governments.
Held very engaging, very participatory meetings, and that I believe the final list of the PAMIs will be a product out of consensus reached by all the parties.
Compared to what we had done before, this process has been very informative.
During this week, a total of 255 PAMIs have been identified, which will be prioritized by the government in a national elimination plan.
As a result of PAMI identification, Uganda is now prepared to target multi-sectoral strategies to eliminate cholera.
For us as a ministry, our involvement in this entire process, first of all, it has been an eye-opener. It has also given us evidence-based information to help us in our planning. This is going to help us make more realistic targets and also more realistic plans that will help us in the elimination of cholera in Uganda.
Going forward, I see we're going to have a national cholera plan, 5-year national cholera plan that speaks to the actual issues on the ground.
So we believe that if all of us as sector players in this put efforts together and we all plan in that line, we'll hit the target that we are looking at, and that's the elimination of cholera in Uganda. And we are very hopeful because we know that we are capable. We are very capable. Yeah.
The exercise is bound to lead to great achievements, and that it is possible to be cholera-free by the year 2030.
Like Uganda, engage in PAMI identification.
Like urge countries which have not yet enforced PAMI, it is a very good process. It allows them to come up with a very good plan.
All together, we can end cholera